from Istanbul in Koç University, and I have here another patient, Nicola Brown. I call you Nicola, is that okay?
Yeah.
Okay. And she has the similar surgery with the patient that we've just talked about and actually seen. But the difference is today is the second day after the operation of Nicola's operation. And the difference is, in the other patient I did gynecomastia, that means the excess skin on his breasts. But here what we did is the liposuction and tummy tuck. And this is the second day, and the drains are compared to the other patient is bringing much less. And I think she left behind the most difficult time. I mean, it's the first night usually after the operation. So we will talk to Nicola about her own experience and her impression. Generally speaking, so far, can you say that you are happy with what happened? I mean, from the point that you arrived here, I know that the clinic is taking care of you.
Yes.
Sort of meeting in the airport and bringing here before the operation, and I assume that you have no problem with that because it was a short period.
Yes.
But before the operation, I tried to talk to you and explain what's going to happen and what we could do and what we could not, and the difference between the other patient, comparing the quality of your skin and the pregnancy history makes the operation more or less, a little bit different from the other patients. So there's no operation exactly done in the two other patients. And as far as I remember, we did not talk about the extra fat here as a sort of extension of the breast going under the pit arm. But somehow, although we didn't talk about it, I just used my liberty because relying on you that you will be just appreciating it because we did not
so,
yeah. So I did the liposuction here as well, so that your breast will be looking more round and defined. As for the major operation, I did about 2 kilos, 2 liters of fat liposuction. And the amount of the abdominal plastinometry was about 1 kilo, so I'm expecting in about 3 weeks you will be losing 3 kilos. I don't know how much pound it corresponds to, but somehow from now on I can guarantee that you will not be able to put any more weight here or there on your back in the area that I did liposuction. It's not physically possible to put some fat back on. So, the internal tightening is a part of the procedure in patients who have some pregnancies or too overweight patients due to intra-abdominal fat accumulation. So it causes the abdominal wall as a whole overexpanded. So this overexpansion influences, most importantly, in the middle between these 2 muscles that we have here. So these 2 are strap-of muscles split apart, so it causes, sort of laxity inside, in addition to the skin getting too loose. So I think the general experience out of 21 years, if I do just skin tightening, I don't remember any patient even complaining about their pain after the operation. But as for the muscle tightening, internal tightening, it's inevitably painful.
That's what I can feel.
Yeah.
It's just here.
Yeah, exactly.
Yeah.
But actually, in the long run, that is the point that you would be, happy more than anything else. Keeping these drains on rather than taking it out is helping body to recover, faster. As I said, because it's not blood, even if it stays there, it will just take a little bit longer for you to get rid of the slime. But as I said today, I'm actually empty them, evacuate them, and I will try to see you tomorrow as well. So I will give it another 1 day chance, to help the body. Okay, and you say that you're not suffering from too much pain. You have some pain here on the back.
Well, not on the back.
It is.
Yes. Especially last night in bed, when I hadn't had it before. When I moved, it was
Yeah. Okay. Yeah. I'm going to give you some tricks. When you start moving around, the pain will go away. So that's the trick with the liposuction.
Yeah.
If you just lie down without moving, it will be more pain.
Oh, I've been moving lots.
Okay, good, because the pain comes from the pressure of this fluid inside on the nerve. Alright? When you move around, the lymphatic system is taking the fluid out. So you could just, as long as you're moving around, it will be better. But I'm telling you, tomorrow will be better, the day after tomorrow will be better, every day, If you're going really fast, so you have no problem with that. But having a pain on the back more than the front side is absolutely natural, because on the front, there's sort of laxity, and the tissue deeper on the front side, but at the back, the limited the area, and when you do liposuction, actually you're carving out the fat, okay? So that's why it causes some trauma on the bottom and on the ceiling, i.e. the skin as well. So as I said, it's just going to go away, solve a big problem. Now I'm going to see you again, can you, is it okay?
Oh, of course, yeah.
And I will try to get something a little bit smaller for you. If it fits you, you will be
yes, because it feels bigger already.
Yeah, I know. So I will try to the smaller one, so that if it keeps you fit, we will send you with that on.
Thank you.
Okay. And as you see, there's we did all liposuction around here, and she has some bruises here. That's absolutely normal, because it's been about the 3 days. This is the 3rd day after the operation. So
and I do bruise easily as well. I bruise at home a lot.
Well, I know, but this is just going to go in 2 weeks or 3 weeks, and if you keep this on 1 more day, it will help you a lot.
Thank you.
Okay, so you can move around from now on. You can do some little massage here on your own, or with someone else helping you. And tomorrow, I guess you'll be sort of off to go to London.
Thank you. See you tomorrow.